COVID cases also on the rise at a number of our schools right now.
Yeah, it's one of the reasons state health officials made some unexpected changes to their safety benchmarks. Our Jason Berry shows us why it's become a controversy.
It's a question more and more schools are having to answer: keep kids on campus or send them back to online learning. Well, some new guidelines from state health officials could make the decision a bit more complicated. It was a change that caught a lot of people by surprise. Arizona's Department of Health Services just updated its COVID-19 benchmarks that help educators decide when students should return to virtual learning. Today, DHS Director Kara Christ explained during a news conference with the governor how they've been working with the Department of Education.
During these conversations, our partners expressed concerns about the instability that would occur if recommendations to move back to virtual learning were based on a change in a single benchmark, especially in smaller rural counties.
But it appears Arizona's Department of Education didn't have much of a say in the decision after all. State Superintendent of Education Kathy Hoffman sent out this tweet today. The Arizona Department of Education did not request or recommend any changes to the school benchmarks.
You can't do that.
Joe Thomas is president of the Arizona Education Association. He says a lot of teachers and administrators feel blindsided.
When we hear in the press conference that they talk to educators, I don't know which educators they spoke with. These were significant changes. They caught a lot of teachers that I talked to completely off guard. It has to make you wonder, well, what was behind the decision to make this change?
Back in August, DHS recommended that Arizona schools stop in-person learning if they hit one of two benchmarks based on the number of cases per 100,000 people and the percent of positive cases. But now DHS is suggesting that schools hit both benchmarks, plus one more, based on COVID-like illnesses in area hospitals. A questionable metric some health experts say is subjective and often inaccurate, since someone with a cough does not necessarily have the coronavirus.
But now that we've finally turned the corner on testing, it's much better to rely on tried and true measures like case rates, percent positivity, rather than this subjective and poorly reported metric called COVID-like illness.
State health officials insist their recommendations are simply a guide for school districts to follow, and it's up to individual schools to decide what's best for their students and staff. In Phoenix, Jason Berry for Arizona's Family.